Hello, this is Dr. David Greene, CEO of the Florida Pain Network. Today's topic is what you need to know about facet joint syndrome. Every level of the spine has two facet joints. They are about the size of a thumbnail, and they're located on both sides, left and right. They contain cartilage just like other mobile joints, the hip, the knee. Together, the small facet joints allow our spines to have an unbelievable range of motion. Even though the facet joints are small, they in and of themselves can be a tremendous source of pain when they become arthritic. So facet joint arthritis starts in the disc. Here's looking at a spine from the front. You see a disc, vertebral body, disc. As the discs degenerate and start to lose water, normally they're 80% water, they can start to lose height. The biomechanics are off on the spine, and the forces get shifted to the back of the spine, which is where the facet joints are. Once they see this abnormal motion, they become arthritic. You can see the excess bone formation, the inflammation, and that's what we're talking about as to how facet joint arthritis, the syndrome, starts. Now, why is facet arthritis more complicated than hip or knee arthritis? There really is no effective facet replacement like we have for the hip or the knee. It's a very complicated joint, and it's very small. You only have two knees, you have two hips, you have 40 facet joints, all right? So you're talking about a lot of areas where things can become arthritic, and that's where it can become complicated. Even the small joints can produce significant pain, or none at all. Why do people develop facet syndrome? Usually it's from good old degenerative wear and tear, which is called osteoarthritis. Now, if you have whiplash or some other kind of trauma, you can develop post-traumatic degeneration. And there's also a genetic component, meaning we don't know everything. And it can be passed down from family. There's a lot we don't know. How is the problem diagnosed? Well, it starts with a good old history and physical exam, and x-rays can be highly suggestive. Now, you should note that patients may have no symptoms at all if that level has severe arthritis, or vice versa. So just because it looks horrific on an x-ray doesn't mean the person's going to be in a ton of pain. Interventional procedures can be very helpful for diagnostic purposes. Here, you see what's called a medial branch block, and that's when numbing medicine is placed around the joint that's arthritic. It blocks the little nerve endings here called the medial branches from transmitting pain. If that procedure is done and it relieves pain, then the pain doctor can say, aha, that's the level that was causing the pain, okay? It also can be therapeutic. That procedure or injecting numbing medicine and steroid into the facet joint can relieve pain for over 3 months on average. Now, what treatments are available? Over-the-counter medications may include anti-inflammatories and Tylenol. For short-term exacerbations, opiates can be helpful. And there's also prescription pain creams and patches that can be helpful as well. Physical therapy, chiropractic treatment, TENS units can be great, and spinal decompression therapy, which is a form of intermittent computerized traction. Now, we talked about the medial branch block. It's both a diagnostic and a therapeutic procedure. Here's a view of a facet joint, okay? There's medial branches coming down, and there's medial branches coming up. As you can see, this is the nerve root. So we're not talking about doing anything with that when we do these medial branch blocks. We're talking about the medial branch nerves. So you have to block two areas, the coming down area and the coming up area for an effective medial branch block. Radiofrequency ablation is a procedure that can become a follow-up to a medial branch block, and that involves going into the same areas but heating up and deadening these nerves, which can give 18 months of pain relief. So here's the catheter going in for the radiofrequency ablation, heating up the area, and that can give long-term pain relief. Typical outcome, medial branch blocks have been 85% effective, with the average pain relief being 3 to 4 months. Facet joint injections have shown the same outcomes. Radiofrequency ablation is 80% excellent results with up to 18 months of relief, and studies show that it's repeatable. Okay, all in all, over 95% of patients are able to achieve a satisfactory non-operative outcome with facet arthritis, facet syndrome. The top non-operative pain management in the state of Florida is through the Florida Pain Network. Over 50 insurances are accepted, and over 25 treatment options are provided by the board-certified, award-winning doctors. For the top pain treatment in Tampa, visit us online at painmanagementtampa.com, and then call us for more information and scheduling at 813-666-4399. I'm Dr. David Greene with the Florida Pain Network. Your pain stops here.